The more contagious Delta variant of the coronavirus has spread across the Philippines, bringing the death toll to a 4-month high. The country has seen more than 29,000 deaths and nearly 1.7 million infections. In an attempt to slow the spread of COVID, the capital Manila has been placed under the tightest quarantine curbs as residents fight for two things they badly need right now: a vaccine and economic assistance.
For those struggling to make a living in Manila, direct government aid like this is a lifeline. The pandemic has shattered their livelihoods. Each household is entitled to up to 4,000 pesos, or about 68 euros. With the money, they hope to survive the ongoing lockdown. I'll use the cash to buy food for myself because I live alone. I don't have my own house, and my living space is very small. I work as domestic help, and my daily wage is only 100 pesos. That's just enough for me to eat. Since last week, Manila and several other cities have been back in lockdown as the highly contagious Delta variant drives a steep rise in infections. For now, residents can only leave home for essential shopping. Some worry the curbs could damage the fragile economic recovery in the Philippines.
Every other day ang biyahe.
We are only allowed to work every other day.
Isang tao lang pasahero.
That's why business is bad. Fearing even tighter restrictions, thousands have flocked to vaccination centers like this in the capital. Many believed misinformation that supermarkets would be off limits for anyone without a jab. Since there was panic among the people because of fake news, our mayor decided to extend the vaccination until midnight or early morning, so that people would no longer congregate in the morning. For others, getting a jab means greater health and job security. This is a big help for us working in the morning. We mingle with a lot of people, so this vaccination is for the safety of everyone as well. But there's still a way to go on that road to safety. Just 10% of the population has been vaccinated so far. As the Delta variant continues to surge, the Philippines is digging in for a protracted battle.
We have journalist JC Gotinga joining us. JC, it's great to have you back on DW News Asia.
Well, it's great to be here. Thanks for having me, Melissa.
Now, you're in Manila right now. Tell us a bit more about how it feels to be in the city.
Well, frankly, it's tiring. It's gotten tiring. People are tired. We are now in the third major lockdown. And mind you, we've been in some form of lockdown since March of last year when the pandemic began. It's just that when the caseloads stabilize, then the government kind of loosens the restrictions a bit. But we've always been under some form of community quarantine. That's the catchphrase here. And people are tired, and especially because they don't see much of a new strategy or plan from the government on how to combat the pandemic. And people are now getting desperate to get vaccinated, of course, to protect themselves and be able to go out and provide for their families. And they're also desperate for government aid, which doesn't cover everybody. It just includes a segment of the population, the poorer segment of the population. And at $20 per person, it doesn't cover much, honestly.
So it doesn't sound like a lot of people would rate the government highly when it comes to its performance combating the pandemic.
Yes. Well, the general sentiment here is that the government has done quite poorly in addressing this pandemic. It has hinged the approach to vaccination, but there are too few shipments of vaccines coming in. And those vaccines that are on hand, well, the rollout is rather slow because there aren't enough resources and manpower to be able to open new vaccination centers. So people tend to crowd around whatever centers are available. And then to add to all that are issues of politics and even corruption. Just the other day, state auditors flagged 67 billion pesos or about $1.5 billion worth of what they call deficient funds from the Department of Health. Basically, what it means is these funds were either not spent or were spent but are not accounted for, and they could have gone to the government's pandemic response effort. It's a huge scandal here in the Philippines now, and the government has not been able to satisfactorily explain it.
Now, I want to talk about vaccines. One of the things we've seen play out has been the struggle for developing countries to obtain vaccines. Good ones that work, because we know that the Chinese Sinovac and Sinopharm ones have lower efficacy rates. What is the Philippines using, and has it been difficult to get them?
The huge bulk of vaccines available here is the Sinovac one. And like you said, there is considerable hesitancy and reservation as to how effective they are, especially since it's assumed that what's driving this current surge in new infections is that more virulent Delta variant of the coronavirus. Just to illustrate that point, some people delayed signing up for the jab to wait for the more reputable brands like Pfizer and Moderna to come in. And when they did come in, people came out in droves and lined up, causing considerable chaos in some vaccination centers. So safe to say, it's really hard to get a vaccine here. You have to fall under certain categories. Either you're a health worker, you're a frontline worker, you're elderly, or you are infirm. Otherwise, you are not even qualified to sign up for the jab yet. And even when you do sign up for one, you have to wait weeks or even months to get that call from your local government to go and line up.
Sounds very, very frustrating. JC Gotinga, thank you so much for joining us.